All right, so good day everyone. I'm Harry, your moderator for this webinar on the behalf of the organizer company called Conference Panel. I welcome everyone for today's webinar, which is called HIPAA Audit Enforcement Updates for 2022. HHS keeps pressure on access, privacy, and security compliance. So now I would like to introduce our presenter for today. Actually, he is my all-time favorite speaker, and usually people call him not Wikipedia, he is Jimpedia. So let's come with the bio. Jim Sheldon-Dean is a founder and director of compliance services at Lewis Creek Systems LLC, a Vermont-based consulting firm founded in 1982, providing information, privacy, and security regulatory compliance services to the wide variety of healthcare entities. He is a frequent speaker regarding HIPAA. So now, over to you, Jim.
Thank you very much, and welcome everybody to today's session where we'll be looking at issues of HIPAA audits and HIPAA enforcement actions and see what's been going on in 2022 and where things look like they're going. It's been particularly active over the last week with a number of new settlements and enforcement actions having been publicized. So HHS certainly isn't letting up the pressure, that's for sure. They're keeping up the pressure on access, privacy, and security compliance. Well, let's take a look through and see what some of these issues are, because that's really what we're talking about is having some understanding of what goes on in HIPAA audits and HIPAA enforcement settlements. So we'll look at the various HIPAA audit activities and enforcement settlements that have taken place over the past few years. We'll look and see what kind of enforcement agreements there have been and the penalties that have been agreed to over to date. And there have been a few that have just been straight fines because some organizations don't want to settle. They just want to pay the money and move on, which, has its own benefits in some circumstances, which is pretty interesting. We'll look and see what are the most prominently featured issues, and it's hard to say that anything but the most prominently featured issue is these days. That is, it's hard to argue with the fact that it is individual access rights, and the fact that just last week they announced 11 new enforcement settlements having to do with access rights, individual access, and having it take too long or not respecting the requests appropriately and things like that. In many cases, you have organizations that received guidance from HHS and didn't pay attention to it. I mean, if we're talking about on the privacy side, the big thing is access. And on the security side, the big thing is doing your risk analysis and all the homework necessary to protect your data. Anyway, the idea is we're going to be talking about audit and enforcement investigations, okay? And so the idea is you want to make sure that before you get the phone call, before you get the message, however they reach out to you, okay, you want to make sure you have the issues covered. The issues that normally show up in breaches. Okay, what kind of things happen to others as far as breaches are concerned, and what have you done to prepare yourself for that? Make sure that you also look and see what kind of enforcement actions have been taking place and make sure all those things that people are getting busted for, that you're not going to get busted for. Okay, make sure you're doing all the right stuff to keep all those problems, so you can just read through those announcements of enforcement actions and go, whew, we wouldn't make that mistake. We would pass that with flying colors. Well. When you see what people, the mistakes that people can make, you discover it's pretty easy to make mistakes. So you want to look and see what are the problems others have in case there's something that you've missed. Privacy rule has been around for quite some time now, pushing 20 years has been enforceable, not quite, but almost. And what that's all about is balancing the rights of individuals and the controls on usage and disclosures for the agencies and organizations and healthcare providers that are in charge of their healthcare information. Okay, so when it comes to healthcare information, it has to do with what rights the individuals have for getting copies of their information, or asking for changes if they think it's wrong, or restricting disclosures, or things like that. Balanced with the obligations on the organizations as to how they're allowed to use or disclose the information. Now, when we talk about audits and enforcement activity, audits and enforcement are really two different kinds of tools, but they have the same kind of objective. Okay, the audits are all about a learning experience for HHS and for covered entities. It's all about looking to see, well, here's the rules. How are people doing with compliance with the rules? Do we need to adjust the rules? Okay, do we need to change what our focus is to be able to deal with the problems that we're having so that we can have better compliance and make this more practical and useful? Okay, so as the audits are all about these learning experiences for HHS, and in 2012, they looked at all the rules. They did a full, soup to nuts, A to Z compliance review for HIPAA compliance. And provision of individual access to medical records was the #1 privacy issue by far. 3 of the top 5 issues were all related to individual access. That's how bad it was, okay? And in 2016, they focused, there are very few areas they focused on in that overall audit process itself, but of the two areas they look at in the privacy rule, one of the patient access of health information, because that's such a key issue. So the whole thing is audits are designed to be learning experiences where HHS can find out where are the problem areas, where should they be doing things, where do they need to put out some guidance, where might they need to focus their enforcement. And enforcement is intended to encourage better behavior and discourage improper behavior, okay? So with enforcement, a lot of times it's going where the patient complaints and the breaches take you. You look and see where things have gone wrong, look and see what people are calling you about, and say, well, what do we have to do? And we have people who are not paying attention to the rules. And of course, a big lesson right now is if you're looking at learning from enforcement activities, when you look and see you have 38 settlements for individual access rights violations since September of 2019, you can see that this is not a minor focus for HHS. They're really very interested in following through on this, you might say. So what's likely for future HIPAA audits? There's no permanent plan for auditing yet, at the time anyway. There are no new audits expected soon, but it's still in the law and can be resumed anytime. Enforcement activity, on the other hand, has been very active recently. And like I said, we had 12 enforcement actions announced just in the past few days. So that's a pretty hefty number. And also, HHS Office of Inspector General is also looking at HIPAA security compliance because remember way back when you accepted money for your new EHR system? Well, part of that is assuring that you have done the appropriate risk analyses as you receive your EHR systems and as you've been using it, okay? So if you haven't been doing your risk analysis all along, you risk having HHS OIG come by and say, you haven't been doing your risk analysis like you should have? Well, I guess we're going to have to ask for our money back for our EHR. Well, you don't want to be in that position, right? They'll be auditing your compliance with doing what you should have been doing. So at least if you haven't been doing it right already, start now. Make sure you do a good security risk analysis. Also, state attorneys general are also, getting busy with various enforcement activities. They're not slowing down. New Jersey Attorney General has penalized a vendor and the provider, the healthcare provider they're working with. The vendor had a problem where some information was breached, and so both the healthcare provider, and the vendor got penalties, but also the vendor is also banned from ever working in New Jersey again. Well, again, thank you very much, everybody, for listening today. I know that there's a lot of wrinkles to HIPAA compliance, and it can seem overwhelming at times, but it's the sort of thing where if you look at what are the issues that people are focusing on, what are the areas that get covered by Health and Human Services, and what are the areas where there are enforcement and audit activity, that can give you an idea of what kind of things you want to make sure you're getting right in your own practice. Please enjoy the remainder of your day.